One of the most important choices you'll be faced with is which form of renal replacement therapy you receive. Before you can make any decisions, you should discuss the options with your consultant and find out if there are any reasons, medical or otherwise, which may make certain options difficult for you. And talk to your family and carer, as the decisions you make will almost certainly impact on anyone close to you.
The practicalities of life is what's important to the patient. It's how is it going to affect them.
In almost every case, the right treatment should be decided by the patient and their carers.
It's not just what's clinically going to work better for you, it's everything. How's it going to fit into your lifestyle? How's it going to affect how you feel about yourself? Affect relationships as well.
And the choice of treatment should be based upon what the patient feels will suit them best in terms of their lifestyle and their plans for the future.
For the majority of people, the choices are haemodialysis HD or peritoneal dialysis PD. HD requires a fistula to be inserted into a leg or more usually an arm. This then connects you to a kidney machine either at home or in a unit. If you think HD is the best option for you, then the earlier you make that decision the better, so that you can get your fistula fitted and avoid having a temporary neckline. For peritoneal dialysis, a tube is surgically fitted into your lower abdomen. This can be used for manual exchange of dialysis fluid through the day, CAPD, or it can connect to a machine which automatically runs the fluid exchange through the night, APD. In addition to this, many patients opt to have a transplant, if and when a suitable donor kidney is available. There is also the choice of conservative care, where, for a variety of reasons, a patient may decide not to have renal replacement therapy.
For the very elderly, we do have some quite good evidence that starting on dialysis can actually shorten your life expectancy because of the complications that may occur in elderly people. And so, in many instances, it's a good choice to not have dialysis treatment. Patients who make that choice will occasionally change their mind, and it doesn't mean that having decided not to have dialysis treatment at one point in your life, as things deteriorate and your illness becomes more obvious to you, that you might decide later to change your mind and go on to dialysis treatment.
And whatever your treatment choice, if you find it's not working out for you, you should discuss the alternatives with your consultant, and will usually be able to switch to a different therapy. Michael lives with wife Pauline and daughter Zoe, just 2 minutes away from the satellite unit where he has HD 3 times a week.
Since having the treatment on chemo, I've been more stable. My health has improved. I physically feel a lot stronger. I'm less likely to be ill. Everything's good.
Right, get yourself comfortable. I do this 3 times a week for 4.5 hours each session. But saying that, it's not just 4.5 hours, it's time to hook up and to take off. There's clotting times, there's preparation time, I would say plus or minus an hour to 2 hours on top of your 4.5 hours dialysis. You know, I talk to nurses, they talk to me, time flies. Yeah, it's a part of the treatment, I think. It comes as a package.
We'll work together to trial little things, new needles, faster pump speeds, quicker dialysis flows, bigger kidneys. These are all things which we've tried with recommendations from nurses and the renal team, which has gradually improved my dialysis treatment. The best thing is I've got my weekends free, my Saturdays and Sundays, where I can relax and I should go out and day trips and go away for the weekend, don't have to think of dialysis.
Pete Kumar has also chosen haemodialysis, but has opted to have his treatment at home, as this fits him better with his family commitments and his job as a taxi driver.
No, this way.
I can dialyse whenever I want to, how often I want to. I can dialyse like every day if I have to. With home haemodialysis, it takes one of your bedrooms up. The amount of stock, the machine itself, it's quite big. The machine automatically goes through its function checks, its safety checks. If there's anything it needs to tell me that an engineer needs to come out. I do this 3 times a week. you know, and every time it's always the same. Once I'm actually connected to the machine, I'm on this machine for 4 hours. You know, watch a bit of DVD, you know, an Asian film lasts 3 hours, that's 3 hours gone quickly. Once you're dialyzing at home, you've got to have that family member with you at all times, just in case your blood pressure drops or something happens to you or you need assistance whilst on the machine. That person needs to be there to know, to understand what is wrong with you and what to do at that situation. And again, come on, go back. I go to work, you know, come back, play with my kids, do the housework with my wife, and dialyse. That's what my life is.
Diane Swift opted for APD. Completing her treatment overnight enables her to keep her days free.
When I spoke to the consultant and dialysis nurse, they went through every option with me. It's just about freedom, isn't it? It's lovely. Peritoneal dialysis for me seemed the better option. It's easily hideable in your clothes and it doesn't restrict you from wearing any type of garment. It's quite easily manageable and it doesn't cause you any discomfort. This is my normal week to 10 day supply. Over here I've got me 5 litre bags of dialysis fluid, I've got me 3 litre bags of dialysis fluid. I had to go for training just to learn about the machine, how you set the machine up and cleanliness. You've got technical support from the machine company if anything ever happens in the night. You've got a number there and they ring you back straight away. The help is there. Plug your phone in to charge your phone. So I just plug myself in to charge my body for the next day, and that's how I find it. I just go to sleep, don't feel a thing, and then I wake up and then it's like end of therapy, and then I just carry on my day as normal.
Married to Dean and mum to Henry, Sally Bruin went back onto CAPD after her transplant of 17 years failed. For her, the routine is manual fluid exchanges 4 times a day.
Definitely the advantage is obviously the independence, to be able to carry on as normal life as possible, not having to go into hospital, to have everything at home and on hand. I tend to say, right, yeah, I've got to do 4 a day, and as long as they're evenly spaced, you're not constantly looking at your watch, oh, I've only got another hour and I've got to do another bag. You've got to be careful not to let it overtake your life. I actually wear gloves to do mine. You don't need to, but I find that because of the regular amount that you wash your hands and all the fluids that you use, they can get very, very sore. Because CAPD gives you the independence to be able to do it at home, you have got to be able to manage yourself. It doesn't take long, roughly 20 minutes to half an hour, and I find I just sit and relax and read a book or do some sewing, and the time goes very quickly. Because you are dialysing every day, you're getting a nice balance of dialysis so your health doesn't drop. So to just miss 1 bag very occasionally doesn't hurt.
Before you make any decisions about your dialysis, it's important that you get a good understanding of the practicalities of each option. Will the treatment fit around your work schedule? Do you have enough room to store the equipment if dialysing at home? And how easy is it to go on holiday whilst on the different types of dialysis? These are just some of the questions to consider. The best way to find information you need is to speak to your renal team. Visit the unit and talk to other patients. Don't be afraid to ask questions, as this is a big decision.
If you're choosing HD, make sure you talk early to your consultant about where your fistula is going to be. There are different sites that can be used, and it's important to get the one that suits you best.
If you're a PD patient and you plan to visit your friends and family regularly, you can have your supplies delivered directly to their homes. It just saves you having to load your car up every time.
Do you drive to a unit for HD? If so, ask them whether they can give you a permit for a parking space. It'll save you some money and is a lot more convenient.
If you're a PD patient, squashing all those supply boxes might become a real pain. You could talk to your bin men, they might be happy to take them away for you.
When you're on HD, your fistula is your best friend, so look after it. Take your blood pressure on your other arm and make sure you don't carry heavy shopping bags, particularly the nasty plastic ones, on the fistula arm.
If you're a PD patient and you're planning to take a flight, make sure you have your peritonitis antibiotics with you in your hand luggage.